in Guyana, this has the potential to change healthcare for the entire country. And once you treat women, once you improve maternal mortality, you're improving the health of the entire country.
It's good to know that you can be in your homeland, be trained, and so not only train the younger ones, but let the Guyanese community as a whole benefit from that.
Well, this is a model that can work anywhere. The model of bringing people together on a volunteer basis who are dedicated to service. You can do that here in our own country, you can do it anywhere.
In Guyana, a developing country in South America, far too many women were dying during pregnancy and childbirth. And disproportionate numbers of their children were also dying prematurely, the vast majority from preventable causes. It was the result of an under-resourced healthcare system. World Health Organization statistics show maternal mortality and neonatal death in developing countries far outpace those in developed nations. It's this glaring disparity that in part motivated Dr. Margaret Larkins Pettigrew, a longtime University Hospital's Cleveland Medical Center clinician and an associate professor at Case Western Reserve University School of Medicine, to simply decide that more could and should be done.
I've seen the issues and challenges of women everywhere. Guyana was on my radar for many years because I had worked there for another organization. It really took having a collaboration with the country itself, having the country buy into their own issues and their own challenges as well as their own strengths. So we actually collaborated with them. This is their program actually, and they said, okay, come in and help us build the infrastructure that is necessary to support such a program.
That program is WONDOOR Global Health. WONDOOR means Women and Neonates, Diversity, Outreach, Opportunity, Research. It's a collaborative partnership between university hospitals in Cleveland and Georgetown Public Hospital in Guyana's capital city.
The unique thing about this program that really attracted me was the fact that they spent a significant amount of time and effort laying an infrastructure with buy-in from the people who are here. The buy-in of the national government, the institutional leadership, the departmental leadership, which I think laid the infrastructure immediately from the get-go for the program that would then be supported and sustained.
And sustainability is one key objective of WONDOOR. It's a healthcare service and training model where OBGYN faculty from university hospitals and throughout the United States and Canada regularly visit Georgetown Hospital to educate and train Guyanese physicians in the postgraduate OBGYN care they sorely lack at home. It's much more than one-off medical tourism. Very few sustainable partnerships like this exist in the United States.
He is Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday, 5 days today.
WONDOOR's mission is to enhance the obstetric and gynecology education curriculum in Guyana and other developing countries by providing comprehensive clinical research opportunities and broadening the skill base of local physicians. WONDOOR graduated its inaugural class of 5 specialists in 2016 and continues to graduate more specialists every year.
They treated me well, and they are still treating me well. No problems, no complaints.
And they've changed the culture at Georgetown Hospital, dramatically improving health outcomes of women and their young babies.
One of the things that we're really focusing now on trying to get the word out on is just the dramatic decrease in maternal mortality that's occurred in this country during the 4 years of this residency program. It's decreased now by about 50%.
Already at Georgetown Public Hospital where we're working, we've seen a dramatic decrease in the number of cases of morbidity and mortality for women at the hospital. There's been a whole change in attitude of people who are working in the program and with the program about how we treat women, how we respond to their needs, what options are available. And so we've seen a dramatic increase in improvement in the quality of care for patients here. But I think it also affects people at university hospitals in Cleveland.
That's what WONDOOR is about, that wherever women come to, that they come through the same door, that they get the access to the same care, because they all deserve the same.
WONDOOR has helped build a new OBGYN care wing at Georgetown Hospital, which previously lacked an operating theater in the neonatal unit. Women had to be moved across the street to the main part of the hospital in order to give birth.
There's more space for the mothers. You have more ventilation, and of course, where there is an infrastructure, you have to get human resource. Where the doctors come in that are trained, they're more qualified.
We have big goals, and the idea or the philosophy is that women deserve the right to quality health care, whether they're thousands of miles away or right here in our own backyard. And the goal is to decrease maternal morbidity and mortality.
All are trained physicians, but they never had postgraduate OBGYN training. It was a lack of exposure that deprived physicians of the concentration and the evidence-based expertise to provide optimal prenatal and neonatal care. WONDOOR has changed all that.
With the graduation of these residents, next year we will have 5 new OBGYNs for a country of about 700,000, when previously there had been 2.
So I'm able to actually compare the care that was given in those 2 years to the last 4 years. And it's almost like black and white. Everything that we do, there's evidence to support. It gives me a sense of satisfaction, and like I said before, it empowers me as a woman.
In our own backyard, we have some of the same major issues, and it's kind of ironic that people who live here in the States and who work in healthcare really don't recognize some of the challenges we have right here until they do work abroad. So I see that as an opportunity as well.
WONDOOR Global Health Program, committed to connecting the resources of university hospitals to measurably improve health outcomes for mothers and babies in developing countries, wherever the need exists.
I'm so excited about the fact that we are here today at this point in the program, and I hope that at some point in my life that they won't need me and they won't need a program, because we can move on and they'll be sustainable.
We've changed the lives of a few, but they're going to go out and change the lives of a country.